Bismillahirrahmanirrahim. The code for today is have more than you show, speak less than you know. I am Dr. Muhammad Awasgil and today I will present on Human Resource for Health and WHO framework under the kind supervision of Professor Saira Aksai. The learning outlines for today's presentation will be about the Human Resources for Health program, Human Resources for Health Observatory, main objectives, policy and strategy, WHO framework, recent updates, and at the end will be the MCQs. At the end of this presentation, participants would be able to describe Human Resources Health Program, its objective strategies, WHO framework, and they would be able to answer the MCQ sessions. Now, what about the Human Resource for Health program? Human Resource for Health are widely recognized as a key element for scaling up health interventions to achieve national goals and health-related targets. Precisely defining and describing human resources for health can help to identify opportunities and constraints for scaling up health interventions and improving the quality of healthcare services. The need for better data and information to inform policy development had led to the creation of Human Resource for Health Observatory in the region. The observatory collects and analyzes data on health workforce for more rational approaches to their development. Now, the Human Resource for Health Observatory. The Eastern Mediterranean Human Resource for Health Observatory is a cooperative initiative funded by the European Commission to promote, develop, and sustain a knowledge base for human resources for health in the region. It provides evidence for policy decisions to strengthen health systems and improve health service delivery. The purpose of this initiative is to provide technical support to member states in sharing and using proactively the best and most innovative options to tackle HRH challenges. The observatory offers up-to-date statistical data, policy briefs, research publications, and other resources. The observatory makes available the latest human resource for health-related findings and research to the widest possible audience. Its main objectives are to collect and synthesize data on health workforce and healthcare labor market in the country or region, to track and assess the dynamics of the workforce and the labor market to identify changes and trends relevant to policy making and planning, to improve the evidence base by conducting new research, policy mapping and analysis, evaluating intervention, forecasting exercise to identify the satisfaction and expectation of health workers, cost policy options, and carry out comparative studies between occupational growth subnationally and internationally, support, inform and track policy and planning by identifying policy options, assessing the feasibility of interventions, planning scenarios, disseminating international good practices, and preparing policy briefs. Improve and strengthen the capacity of and understanding of senior policymakers and planners, technical staff, and human resource for health managers and HRH issues, and to advocate and facilitate policy dialogue with stakeholders. Know what is its strategy and what is its objective. The overall strategy for the observatory is to provide a framework to formulate a general agenda and support an interinstitutional and intersectoral environment for the development of human resources for health policies at the regional and national level, reinforcing the use of available information. Our transnational agenda of human resource issues is currently taking shape to ensure a comprehensive approach to human resource for health challenges. Our perspective for the coming years would be the constitution of regional or sub-regional forms or policy dialogues on the action fields and priority topics, such as inequities in the distribution of health personnel, international migration of health workers, homologation or accreditation of education programs, among others. To the conceptual framework for human resources for health. The Human Resource for Health Action Framework is designed to support governments and health managers to develop and implement strategies to achieve an effective and sustainable health workforce. By using a comprehensive approach, the framework will support countries in addressing staff practice, uneven distribution of staff gaps in skills and competency, and low retention at work, low retention and poor motivation among the challenges. This framework was developed by representatives of multi-lateral and bilateral agencies, donor partner countries, and the academic and technical institutes by the WHO and university. Notice a flowchart diagram where the situation analysis, paneling, implementation, and monitoring and evaluation goes to the phase of improved health workforce And if it is met by other health system components and country-specific contexts, including labor market, then it will go to the health services, equity, effectiveness, efficiency, and quality. Now coming towards the HRI WHO framework. Now, the WHO framework provides a pathway for governments and health managers to develop a comprehensive plan for addressing the critical shortage of health staff. It is used to identify the key findings and analyze constraints to addressing human resource gaps in six components that are HRM, finance, education, policy, partnerships, and leaderships. The benefits for developing and implementing a comprehensive HRM plan include an adequate supply of well-trained and motivated health staff, increased performance and cost savings because of decreased absenteeism and staff turnover, a healthier population. Now, the developing an HRS strategic plan and policy. It is done in three stages. First is the assessing current status of health workforce, that is level, distribution, and performance plus capacities of health workforce policies implementation, with a particular focus on four aspects of finance, education, management, and policy making. Identifying policy priority requirements and actions based on the current status of health workforce, showing how to sequence policy and drop a prioritized action plan. Now, the stage one is assessing HRI with the conceptual framework, that is the WHO method. Assessing the status of HRI includes the density, level, and performance. HRI performance comprise both personal efficiency and provider quality. Both have further categories, efficiency and quality and healthcare. Efficiency have financial efficiency and productivity, while quality in healthcare includes clinical quality and patient satisfaction. Human workforce performance is different from HRI performance. There are four dimensions of human workforce performance, that is availability, competence, responsiveness, and productivity. Now, the assessing policy levers. These are financing, education, management, and policy making. The first is financing. It assesses the allocative operation efficiency of HR financing, as it is important to evaluate whether the funding is being used efficiently. It involves at least two concepts. These are whether the salaries are producing the highest levels of services for funding, that is the operational efficiency. And the second is whether the salaries are right thing to funding for achieving health objectives, that is the allocative efficiency. Its indicators are balanced between different categories, level of spending on health purposes related to total health expenditure and the proportion of GDP dedicated to health and the per capita expenditure on health. Number second is education. It assesses education quality based on standards. World Federation for Medical Education Standard, that is WFME 2003, was chosen as a starting point for identifying indicators for the quality of health professional educations. Their trilogy of global standards covers three phases of medical education, that is basic, postgraduate medical education, and continuing professional development. WFME identifies nine areas of quality assessment and potential improvement of health professions education. These nine areas are mission and objectives, education program, assessment of students, academic staff, students, educational resources, program evaluation, governance and administration, and at the end is continuous renewal. The next is management. The components typically associated with human resource management or human resource development include a variety of personal management practices that include personal policy, that is classification system, compensation and benefits requirements, recruitments, transfer, promotions, disciplinary, grievance procedure, and personal files. No, this is the framework for rapid assessment of management of human resource for health, that is public sector context. It involves the decentralization of human resource function. Decentralization means the allocation of resources from the centralized system to the more local context. Next is the stewardship of the human resource for health. That includes senior management of public sector human resource health. Next is the core administration of human resource management, that is job description and performance review. And then is the institution environment, that is working conditions. And at the end is facility organization practice, that is the teamwork. The next is policy making. The World Health Report 2000 emphasizes the need for political and stakeholder analysis in assessing health system performance. The framework identifies five main steps to be taken to conduct a proper stakeholder analysis for assessing policy making and for developing political strategy for influencing policy. That includes the policy players, opportunities, and obstacles, strategies, and impacts in order to define the appropriate policy for human resource in a country. Background research must be conducted to develop a picture of the general political system of the country. This analysis should include type of government system, ability of the state to enforce laws and regulations, transparency, and policy change processes. The next stage is prioritizing policy action and requirements. Prioritize problems as identified during stage one based on some criteria, then identify the cause of priority problems using diagnosis. Three, then choose policies to improve them. No, next is the criteria may be developed considering national priorities appropriate to health status problem. National priorities considering non-health priorities mentioned in WHO 2000 reports such as patient satisfaction and financial security, workers involved in preventing high-cost care disease. The current schedule on health workforce reflects some basic priority setting and should be taken into account. Preliminary assessment of political feasibility and consider either developing political strategy to overcome opposition or modifying proposed changes, considering logistics of increasing the quality and not just the quantity of workers. The stage three is showcasing the implementation of reform strategies. It begins with priority setting, giving priority to the training of some of the categories of health workers means that expansion of other categories needed to be delayed until the target for the priority categories are fulfilled. Two major choices are one showcasing are but in smaller incremental increase and more rapid large scale increase in number of health workers. The second is about increasing number of workers and first investing in improving health system around the existing workers. A balance needs to be struck between these choices. Then develop a work plan using a critical path analysis or similar planning tools with the help of dialogue with national officials and donors to ensure realistic time of activities. Know the time for the recent updates. The first article that is included in measuring the availability of human resources for health and its relation to universal health coverage for 204 countries and territories from 1990 to 2019. A systematic analysis for the Global Burden of Disease study 2019. It concluded that consider expansion of the world's health workforce is needed to achieve high levels of universal health coverage, effective coverage. The largest shortages are in low-income settings, highlighting the need for increased financing and coordination to train, employ, and retain human resources in the health sector. Actual HRI shortage might be larger than estimated because a minimum threshold for each category of health workers are benchmarked on health systems that most efficiently translate human resources into universal health coverage attainment. Sorry. The next strategy is exploring the antecedents of AI adoption for effective HRM practice in Indian pharmaceutical sector. The aim of this research is to investigate the factors that facilitate the adoption of artificial intelligence in order to establish effective human resource management practices within the Indian pharmaceutical sector. The findings of this study shows that an examination of the relevant literature reveals factors such as how prepared an organization, how people perceive the benefits, and how technological readiness influences AI adoption. As a result, HR systems may become more efficient. The tool that they have used is BLS, SEM, and the data support all the mediation hypothesis by moving both full and partial mediation, demonstrating the accuracy of proposed model. There has been little prior research on this topic. This study adds a great deal to their understanding of what more motivates human resource departments to adopt AI in pharmaceutical companies of India. Furthermore, AI-related recommendations are made available to HRM based on the results of a statistical analysis. The next recent advances includes is still mix and task shifting model. It is an appropriate skilled workforce with right mix of skills and roles is at the center of health systems capacity to respond to a population's changing health and care needs and is a major factor influencing how well systems perform. However, the evidence on the nature of skills and roles required, their distribution and evaluation over time, and their composition to ensure provision of the right care in the right place at the right time is sketchy, and there are significant conceptual and practical gaps. The European Observatory on Health Systems and Policy aims to address these issues systematically and So provide decision makers with a better understanding of the tools and to address skill mix in a systematic way and to realize the potential of the health and care worker along with the service users and their carers. The European Observatory's work plan monitors skill mix and task-shifting innovation in the primary and chronic care. This includes both country case studies and systematic reviews, and emphasis is currently placed on following aspects. These are skill mix and task shifting innovation in the prevention and health promotion, ambulatory care, including transitional care, chronic care for patients and that can live independently, palliative care and skill mix for rural, under-reserved and urban deprived areas, education implementation and change management of skill mix innovations. Now the time for the MCQs. The first MCQ is national health system is facing severe health workforce shortages in rural areas despite having trained personnel in urban areas. What policy action under the HRH framework would most effectively address this? Whether increase the salaries of urban health workers, implement skill mix and task shifting in rural areas, invest in infrastructure and rural hospitals, whether train more health workers with the focus on primary care or reduce health workers capacity in urban areas. What do you think, which is the correct option? It's B, implement skill mix and task shifting in rural areas that will benefit the most. Next MCQ is a country is developing HRS strategy. In stage one, they are assessing the current status of their health workforce. Which of the following should not be the focus during the stage? Whether workforce distribution, health worker performance, policy sequencing, education quality, and financial efficiency. It will the policy sequencing. That MCQ is during the evaluation of a national HRA plan, the government realized the need to prioritize health worker training. What is the most appropriate sequencing strategy according to HRA WHO framework? Whether implement a rapid increase in worker numbers followed by system reform, prioritize training a specific category of health workers before expanding careers, similarly increase the workers and infrastructure, train only urban health workers first.
C. Prioritize training a specific category.
Yes, it's cheap, prioritizing training a specific category of health workers before expanding the rest. Fourth MCQ is a health policy planner is tasked with improving healthcare delivery in underserved areas by emerging task shifting. What would be a strategy according to HRA framework? Increasing the number of specialties in local hospitals, focusing entirely on preventive care, ensuring the workforce has an appropriate skill mix for population needs, reduce the use of community health workers, or centralizing all health services in the cities. Yes, reducing the use of community health workers. Question secure is our country has its HR performance based on availability, competence, and productivity. Which of the following would improve the HRH availability? Whether increase health workers' salaries, conducting frequent training workshops, adapting absence and so better workforce management, reassigning assistants to different regions, implement telemedicine in urban hospitals. It's the reassigning assistants staff to different regions. This MCQ is in an HRHS survey, it was found that health workers in remote areas are leaving their posts due to lack of career progression. What policy intervention can address this issue? Whether translating performance-based salary increases, reducing workload through automation, providing clear pathways for promotion and career development, increasing the number of health workers in urban areas.
D.
Yes, we provide clear pathways for promotion and career development. Seventh MCQ is our country is facing challenges in aligning their workforce with population health needs due to poor distribution. What would be the most critical policy step under the HRF framework? Whether it is health worker recruitment, implement policy dialogue with all stakeholders, establish a financial incentive for rural settings, train workers only in tertiary care services, shift resources to urban areas for specialized care. Is we implement policy dialogues with all the stakeholders. Eighth MCQ, during the final stage of HR strategy plan, our health ministry wants to prioritize healthcare workers' education. What should be their primary focus based on WHO guidelines? Whether infrastructure development continues, professional development and education renewal, political stakeholder alignment, immediate increase in worker compensation, and task shifting in specialist services. It's B, continuous professional development and education renewal. Ninth MCQ is in conducting a stakeholder analysis for HRA policy, which of the following is not a main step in developing political strategy for influencing HR policies? Whether identifying key players, developing technical training programs, defining policy strategies, assessing opportunity obstacles, evaluating the policy impact on stakeholders. It's B, developing technical training program. The last MCQ is our national HR policy plan is asked to improve allocative efficiency in health workforce financing. What should be their primary focus? Whether ensuring that health workers are paid more in urban areas, evaluating whether salaries are aligned with achieving health objectives, hiring more administrative staff to oversee finances, increase the number of health workers regardless of budget constraints, conducting patient satisfaction surveys. It's be evaluating whether salaries are aligned with the achieving health objectives. Now, this is the key of my MCQs. This is our YouTube channel where all the presentations from the community medicine department of King Edward Medical University are uploaded here. And thank you very much for today's presentation.